Welcome, everybody. Very nice to see you. We're going to give everybody just a minute to pop in to the meeting room from the waiting room. How is everybody today, this evening? Good? Everybody good? Give me a thumbs up or a wave or something. Yeah, excellent. So I hope you've learned some things through the day. And we'd like to wrap it up in a big way. So with more information for you today. So I should introduce myself. I'm Dr. Judy Ann Kellaway. Although I think I recognize some names from Club Pre-Med out here in the audience. So I'm Dr. Judy Ann Kellaway. I'm the Associate Dean for Admissions and Outreach at Long School of Medicine here in San Antonio, and it was great to have you all with us through the day. I've been watching your emails for your video interview pop in my inbox here and there, and I hope you enjoyed the day. We really feel like this is a necessary and usually a really valuable, very valuable experience, so we hope you're going to find some value in it. This is now, we've done it twice, so it's a tradition. And like I told our medical students, after you've done it twice and it's a tradition, there's power in that. So we're so happy that you joined us for our second annual, and you'll have to tell your friends about the next one. Okay. So right now I'm gonna come back and talk to y'all in a little bit, but I'm gonna turn it over to Cassie Compion, who is going to introduce the medical students and start the next part of our show. Thanks, Cassie.
Hi, everyone. My name is Cassandra Compion. I'm going to go ahead and share my screen real quick. There we go. Can everyone see my screen? Yes? Okay. So as I said, I'm Cassandra Compion. I'm the president of the Latino Medical Student Association here at Long School of Medicine. I want to thank you all for joining us today. I hope that the feedback you got on your interviews and your personal statement, along with what you're able to learn here throughout the workshop, will help you be successful in your application cycle, whether it's this cycle or in the upcoming years. Before I get started though, I want to say a huge thanks to the other officers in LMSA. This was a giant coordinated effort and I could not have done it without them. Jaime Quirarte, Vice President, Natalia Simonetti, Secretary, Corina Baldillo, Treasurer, Juliana Restrepo, Events Coordinator, Matthew Maya, Outreach Coordinator, and Freddie Calderon, Programs Coordinator. And a huge, huge thank you to Dr. Judy Ann Kellaway. Her help was invaluable and we could not have done this without her support, so thank you. Before we get started, I'd like to ask everyone to make sure that their microphones do stay on mute throughout the presentations, just to limit distractions. And if you have any questions at all, hold on to them. At the end of this, we will be having a Q&A session where you can ask either the medical student or Dr. Kellaway any questions that you have. We're going to go ahead and we're going to start with the application portion of this workshop, and then Dr. Kellaway will go ahead and take over for the interview portion of this workshop.
Hi everyone, my name is Corina Badillo. I'm with LMSA, and we're going to start off with going through TMDSAS and MCAS, so the Texas Medical and Dental School Application Service. Tends to cover a lot of the Texas schools like the UT, the Texas Tech, A&M, UNT, University of Houston, and Sam Houston. And whereas MCAS covers basically all of most of the medical schools across the country, especially the MD schools, and then includes some private schools in Texas like Baylor. Some notable exceptions are you will not find the TMDSAS schools on the MCAS application service, and you won't find some DO programs there either. They'll be on AACOM's application service. Quickly, I wanted to point out that both services do have application guides and handbooks that are super helpful and really do help to walk you through the application process, answer a lot of the questions about what to fill in and what spot and where you can get some help for that. So I definitely recommend that you take a look at those, as well as Q&A pages that they might offer. The big question here is, how many schools should you apply to? So some factors to consider are the cost of the applications, because you'll have primary and secondary applications, and some of those, the secondary application might range between maybe just $40 to even $100 per secondary application to each school. So that could add up really fast depending on the number of schools you're applying. Another thing that adds up really quick is the workload. So each secondary might have maybe 2 or 3 short essay questions that you'll have to answer, and you'll kind of be flooded with them in, typically speaking, on a normal year in early July is when you get access to your secondaries. And so it's like a lot of work that you, with a fast turnaround. And some of them have different deadlines too, so keep that in mind. So I would really recommend that you focus on sending applications to schools that you really see yourself at, and that the quality of your application materials matters a lot more over the quantity of applications. So we can move on to the next slide. So in this slide, I have a timeline of what TMDAS typically looks like. We've heard that because of COVID, that everything's been pushed back a month. So instead of the main application being due in October 1st, it'll be due November 1st, excuse me. So keep an eye out. If you had already made note of when all these deadlines are, definitely look them up. They might change from school to school. And then they might change in your favor as well. Okay, so every year the application normally opens up at the beginning of May, and then the next big deadline will be the early decision deadline, which is usually October 1st. And then the application for everybody else will be, the early decision application will be August 1st, and then the regular for your primary is October 1st. And let me pause right there. Just to be clear, to apply to medical school, the first application that you send, like your personal statement and your diversity statement, like your transcripts, that initial application is called your primary. Once you submit that to the schools, then they will send you a secondary application, and some of them will read your first application before they decide to send you a second one, and some of them just send you a second one. And it's just part of they'll read it all together. So every school is a little bit different on that, so keep that in mind. Then after you get through your secondaries, and then you will have your interview systems. You'll have the interview season, which goes from July to January, which I'm not sure if that might change up a little bit because of the COVID. So definitely keep an eye out. The individual schools should have information, and TMDSAS is also another place to look out for that information. Okay, now while the deadline for the regular application is usually October 1st, in this case November 1st, most applicants most applicants will submit their application much earlier. The interview spots tend to be given on a rolling basis, so you just have a higher chance of getting a spot if you submit early on. And getting more interview spots usually correlates to having better odds of an acceptance. So it's definitely in your favor to apply early and get that primary in as soon as you can, and then get working on those secondaries also as soon as you can. The next thing that I want to cover is back to the early decision program. So that, first of all, only some schools offer that option. And that means that you commit to apply to only that school, and that you will wait until you hear back from that school before you really start applying to other programs. And if you get accepted to that school, you've committed that you will go there. However, there is a process for getting released from that. Ideally, I think that program is really great for if you're from like West Texas and you really would love to go to Texas Tech and that's your #1 choice, you have a pretty competitive application, then that would be a really great option for you to look at. But still, most people apply to the regular deadline and they just do the regular process. It would just save you a bit of stress if you did the early decision, if one of the early decision schools were your top choice. And then now, super briefly, I want to cover the match program that TMDAS has, and that's something that MCAS does not have at all. So the way it works is, say you interview at 3 schools. After each interview, you will be able to start ranking those schools onto TMDAS's website. And you have until January 17th, well, that was the original deadline, to input your ranks. And you could change your ranks all up until that date. But after January 17th, your rank is locked in. And on February 3rd, well, the original deadline, February 3rd, you will hear back from the schools. So say the school that you ranked #2 also accepted you. Well, then even if school #3 accepted you, the computer will automatically drop any offer from school #3, or if they declined you, it will drop that. And you will see the offer from school #2. Okay, so what about your top choice? Well, for school #1, you will be able to ask to be put on their wait list if they give you that offer, and that will give you another chance to try to get into school #1, and so you'll have some time to like work your way off the wait list. So in short, the match program really does work in the favor of the applicants, so definitely rank the schools just simply in the order of school that you really want to go to. Yeah. And let's see. Okay, yeah, so we can move on to the next slide, please. Okay, thank you. So for the MCAS timeline, I'm not sure if there's going to be any changes with COVID, so definitely keep an eye out for that. Generally, what happens every year is it opens up May 1st, and then you have about a month to input in all your information, and then within that month, so May 30th or like June 1st is the first day that you're allowed to submit your MCAS application. And quite a few people do submit their application on May 30th, or that first day that it's available. So it's also definitely in your favor to work on that primary and get that going, and to get that submitted early. So once you've submitted that primary in early July, so after that June 28th date is when you start getting your secondaries or have access to them. However, you can work on them a little bit early. Sometimes the schools have the prompts on their website, or you can find the prompts from the previous years, and a lot of times the prompts are pretty similar, or a prompt from one school might help you for next year for a different school. So it's definitely in your favor to start working on that and like start hashing out some of those ideas and those experiences that you might have had. The next big deadline, also the early decision program is similar to TMDAS. I'm not sure about if there are any like specific requirements, or there are any like details that might be different, but all of this information is definitely found on both these websites. So if you are interested in those, go ahead and look that up. You should be able to find information on both early decision programs pretty easily. So while MCAS doesn't have like match or anything too complicated, it does have, it doesn't have one set deadline for all of the primaries. So every medical school will have a different deadline, and it'll vary basically anywhere from August to December. And I'm not sure if COVID, if any of those schools might push back their deadline. So if you are interested in any out-of-state or private programs, make sure you look those up individually. And on that note, the individual school's website is probably the best place to find the specific detail, like deadlines and information about that school. So after you finish your interviews with MCAS, you have on April, so the next deadline is April 15th, and that's when you can only hold, you cannot hold more than 3 spots at a school. You can still remain on wait list for as many schools as you need, as you want. However, on April 30th, you can only hold 1 spot at a school, but you can still be on a wait list, so there's still room for movement. So typically the interview season is July through spring, and I'm not sure what changes might be there. Sorry, guys. Other application deadlines just vary by school again. Things to watch out for are individual requirements that each school might have. So a lot of them use CASPer test as part of the requirement. So make sure you know the deadlines for that, because you can only take a CASPer test on certain scheduled test dates, and those tests will only be submitted to schools by certain dates. So definitely things that you need to look into individually. One thing that I recommend is making it just a giant spreadsheet with all this information. The one thing I regretted is not putting more information to my spreadsheet when I was applying. Just have all these deadlines on there. And then transcripts are a little different because each school has this different deadline for the transcripts, so another thing to keep an eye on. Oh, and then there's a distinction between when a deadline is that you must submit something by a deadline versus a school or MCAS has to receive that material by a deadline. So make sure that you know what's due when and what the requirement actually is. And
Hey everyone, so my name's Jaime Quirarte and I'm the current Vice President of LMSA. I'm going to briefly go over the personal statement and experience section of the application. Starting with the personal statement, what you really want to do is make sure your narrative gets across here. So you want to focus less on trying to stand out and just telling your story. You can use examples from personal experiences to tell a story that demonstrates qualities such as compassion, respect, humility, and ultimately your desire to pursue medicine. Dr. Kellaway really likes the shoebox method, which she has a great link to on YouTube under Club Pre-Med. We'll share it in a little bit. But basically, to sum up, it's extending the writing process over 3 to 6 months, whatever you feel comfortable with, and just writing a little bit at a time. So you take a question or a topic, you reflect on it, you write what you can in a journal, and over time, you're essentially going to build up a collection of your thoughts and develop your personal statement in a way that you can then form into a cohesive personal statement. Common topics for your personal statement are things such as honors and awards, leadership, research, healthcare, community service, extracurricular activities, work experience, and other activities. There isn't one right way to write or organize a personal statement. However, most people do put it in a chronological order, and typically that works best. A few tips we have: you want to have multiple people read your statement. Grammar is extremely important, and you want to make sure that your ideas aren't misunderstood by anyone on a medical admissions committee. And the best way to do that is to ask your friends and family, does this personal statement sound like me? Are my passions, goals, motivations clear? Don't worry about sounding cliche in the beginning. Some cliche phrasing may actually be the best way to express yourself, but sometimes you work your way out of the cliche as the writing process progresses. Excuse me. You also want to minimize or eliminate anything that's going to distract the admission committee members from your passions, qualities, and motivations for pursuing medicine. So this includes things like avoiding dry humor, sarcasm, and you don't want to limit your scope or patient population that you're interested in working with simply with your personal statement. It's perfectly fine to use the same statement for TMDSAS and AMCAS. However, keep in mind that there are character differences between the two systems. Another tip we have is that we make sure you include paragraphs. It'll cost you 1 or 2 characters, however it makes the statement flow and have an organization that's much better for the reader. And I think it's ultimately worth sacrificing a few characters to increase the organization of the personal statement. So moving on to experiences. So the 2 categories that the application splits up experiences into are clinical and non-clinical. With your clinical experiences, this is going to do basically anything related to patient interaction, such as shadowing, scribing, volunteering in a medical field, research. And in this area, you're going to want to demonstrate your commitment to a career in medicine, service, and show things like empathy and teamwork and other qualities that are extremely important as you aspire to become a physician. Throughout your description, you want to remain positive and respectful towards patients and doctors. And moving on to non-clinical experiences, this is where you can fit in all the other things such as non-medical volunteering, hobbies, extracurricular activities, student leadership role, jobs, and research outside of the medical field. This is going to demonstrate curiosity. It's going to show a person who can connect to people and patients with varying interests, leadership qualities, work ethic, and ultimately what you're trying to do with your experiences is kind of show what led you, in a way, what led you to medicine and how your activities have prepared you to become a doctor or on a path to become a doctor. And keep in mind that anything you include on your application is fair game throughout the interview. So even that freshman year internship, be prepared to talk about it if you want to write about it on your application. Ultimately, there is no right experience. However, it does become easier to and come across as more genuine if you choose activities that you're really interested in. So moving to our next section.
Hi guys, my name is Natalia Simonetti. I'm Secretary of LMSA, and I'm going to talk to you guys about letters of evaluation. So don't freak out if you don't exactly do this, because I know a lot of people get kind of a little scared when we talk about this, but we're going to try to get through this and just give you some tips. So one of the best advices, the pieces of advice that I got when I was applying, it was someone older than me who had already applied, and they said that in order to respect the recommender's time, it's important to initially ask if they're willing to write a letter of recommendation for you at least 3 months before you'd like your application to be complete by. So this means asking them before you even start your personal statement, because some recommenders may take a long time to complete portions, and summers are more a difficult time for professors to respond. That's a good rule of thumb, just so that you're, again, respecting their time. The second point is, when asking for a letter through email or in person, ask specifically if they'd be willing to write an enthusiastic letter of recommendation for your application to medical school. I really believe like enthusiastic is key. You don't want just a mediocre letter of recommendation. You want them to truly believe that you'd be a great candidate and reflect that in their letter. If you ask via email, try to meet with them in person if possible. I know the circumstances recently haven't really made that possible, but definitely try to meet with them over the phone so that they can hear from you personally why you would believe you'd be a great why you believe they would be a great recommender, which means giving them examples of things they've seen you do, so that they have kind of like ammo to write about for you and why you want to go to medical school, because that's really important that they can hear that. So in addition to that, when asking for letters of evaluation, provide your personal statement and resume so that the recommender can use details to enrich their recommendation for you. Many professors would be happy to write you a letter, but if this is the first time that you've reached out to them or the first time they've seen your face, that letter is not going to provide much description about who you are, and it's only going to really reach the surface letter. So that's why, or surface level. That's why it's really important to build a personal connection and get letters from those who like truly know you and have truly seen your character. And then lastly, after submitting their names and emails and the recommender portion of the application, remember to send them follow-up emails to remind them about the application and the deadline that you really wish to have your application complete by. So not necessarily the last day they can submit it, but when you really would like to have your application completely submitted. And then lastly, just always remember to thank your recommenders, because they're taking a lot of time to write these letters for you, and they're doing their best to make it sound great. So just at least like an email or a letter or something, just really thanking them for their time. And then the next one. Okay, so the second part, Kareem talked about a little bit about this, and I'm just going to kind of echo some of her points. Most of you guys know that you're not done after you submit your primary application through TMDSAS or MCAS. So it's important that you know that each school has different requirements, and I know that each school may have secondary recommendations or the CASPer test. And just a brief summary of the CASPer test is, it's essentially, it's a test that puts you through different scenarios, different ethical scenarios, and sees how you would respond to these different scenarios. And it's timed, and you type out each of your responses. I know that UTESCA personally has been implementing this for the past couple of years. Again, remember to check each individual site for specific requirements. I think Karina's idea to make an Excel sheet is like fantastic. I know my year I had just basically all the requirements down for each school that I wanted to apply to, and then I had like a check mark to see if I had done it. And it's like a really easy way to keep yourself organized. It's also important to remember that some schools may email you to complete the secondary application, while others may have you complete the secondary application after you submit the primary application, and they're not going to notify you with an email until both the primary and the secondary application are filled. So there's some schools that you just have to go on your own to their website and fill out the secondary. And again, it varies by each school. Remember that the timing is very important, and that the earlier you turn in your secondary application, the faster your application can be reviewed and be considered for an interview, which is ultimately what you want. And even though that being said, the secondary application is just as important as the primary, and this gives you a chance to elaborate on some of your unique experiences and can add an extra dimension to your application. So just ask trusted colleagues to review and make sure you talk about experiences that you didn't necessarily get to highlight in your personal statement. And just a quick note, I know most schools are going to have some sort of essay on diversity, and just remember that diversity doesn't mean you're not a white male. It's important to demonstrate that you're culturally sensitive and the different experiences that you encounter with people outside of your personal bubble, and there are opportunities. You want to highlight opportunities you've sought to learn about communities outside of your own community, and it'll be really impactful if you can write about those. Okay, you can go to the next one.
All right, well, thank y'all for that. So that wraps up the application portion of this workshop. This is a QR code here for a post survey that we would like you to do. We're gonna also be sending an email with this post survey, so if you don't get a chance to get the QR code right now, it's okay. But please make sure to complete this survey. We are gonna use it to help us kind of create a better mock and talk next year. We just wanna get your feedback to see how this event worked and if it was even helpful for you. So we would appreciate it if you did the surveys. Thank you. I'm gonna go ahead and give it to Dr. Kellaway now.
Okay, I'm unmuted. That was great. That was great. What did y'all think? Use your emojis, you know, or use your emojis definitely if you've got just a black tile there. Yeah, I thought that was just excellent. I did, you know, always, I thought that was wonderful. I wanted to say, did I want to say anything? No, I think it all got covered. I think it all got covered in the Q&A. If anything comes up, we can address it there. Very good job, everybody. I now am going to talk to you about, I don't know what happened there. While I move you all around, we're going to talk about interviewing. Let's see. One second. Let me see if I'm picking the right screen. Okay. Can you all see that plug for Club Pre-Med? Are we good? Okay.
Yeah.
You know, you're never quite sure like what's out there, what's happening. So now we're going to talk about the interview, and I know I see familiar names. Thank you, Club Pre-Med people, for coming back. So you're going to hear some things again. I have shortened it though, so we'll blow by some things and then maybe get a chance to get to your questions. And I want to put my chat over here in case I see anything. Okay, so acing the interview. Let's see. All right, that's what we're going to do. And I've changed it a little bit. I never give the same talk twice. So think about this. What is the purpose of this interview? You know, in person, to come to an in-person interview, we're wanting to see who you are. We're wanting to see your interpersonal skills, your oral communication skills. What are those nonverbal things you're telling us? We're looking for other personal attributes that may not have come out in the application and other parts of the application, and we want to hear you tell your story. Is the interview important? Yes, it is very important. Of course it is. So let's just start with some essentials at the beginning. For a lot of people, do you all feel nervous about this? I told you in one of those recent web chats that, you know, I applied for this job 4 years ago and started working on it a year before that and had like 37 interviews on one visit and then 37 interviews on the next one. Oh my gosh, like over a 2-day period. So I was like tremendously nervous. So I really understand what you might be feeling. You should be feeling a little bit anxious, but you're going to work on these things. So it is a little bit formal. You don't know what to expect. So there's this unknown thing. You might be a little uncomfortable in your suit or those heels, you know. You just don't know what's going to happen. But you can build your confidence by looking at your, you know, evaluating your communication skills, realizing things that you need to work on, verbal and nonverbal. And then you should have confidence in the fact that you know the content, right? It is your story. They are your answers. There might be some things you want to practice, of course, and we'll talk about that in a second. Do you know that you make a first impression in 7 seconds? That's kind of quick. So you want to get yourself ready outside that door. We talked about this. Take a deep breath, put a smile on your face, stand up straight and walk in. Look in making an impression on somebody, especially in that 7 seconds. You don't have much time to say anything. So that's really, the verbal is not a huge contributor to that first impression. It's the nonverbal. It's the way you stand. It's your comportment. It's reaching out with that firm handshake. I hope handshakes make a comeback. So tell me, I'm watching the chat now. Tell me some things you think. We did this before. What are some things that could be nonverbal messages? What kind of things contribute to your nonverbal message? Posture, eye contact for sure. Posture, 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 eye contact, absolutely.
The hand gestures.
Say it again.
The hand gestures.
Hand gestures, yes, absolutely. If you're walking in, wringing your hands and crouched, that's not making, you know, that's not showing some confidence, right? So that's a good one. Please, yes, unmute yourself if you want to say it. Facial expressions, very, very, very important. Very important. So I think you hit on a lot of these. Let's see. Yeah. Grooming, posture, your face and eye contact and hand gestures, all very important. And there's that important firm handshake. Your face tells a story. We're going to talk about it a little bit more. I think it's probably the same in a virtual setting and the real in-person thing. So you want to try to, if your natural relaxed face is a scowl, which my husband tells me I'm frowning all the time, and I say I'm not frowning. I'm just like not. I'm just like my face is relaxed. And so anyway, you have to sometimes purposefully try to put a smiling, engaged face on your face. Let positivity come shining through, smiling. Again, tone of voice, that's a good one. Thank you. I hope y'all are looking at the chat also. Let's see what else. Engage, look attentive. We're going to come back to some of these things too. So we did this before. You may, it's a small enough group, and interruptions sometimes can't be avoided. What do you see in there? You see some great verbal messaging? Anybody want to unmute and say who you see, what you see? You want me to do it for you? Shall we run through it? Oh, yes.
Oh, I was just going to
Maybe.
comment. Yes, the lady with the gray suit, she has a bit of a slouch posture
Good.
versus the lady in front of her with the white suit, you know, with her hands back and her chest up. It's more of a confident, I guess, power posture.
Good. Thank you. Armagon, say your name for me.
I go by Megan, actually,
Megan.
but it's Armagon, yes.
Okay, good. Thank you, Ms. Megan. Dumaybe, how's that for pronunciation?
That's perfect, actually.
Great.
You got it great. I was gonna say they all look like they're strangers. Like they all look a bit, I don't want to say uncomfortable, but you can tell that they kind of got thrown into the picture based on their.
Yes, you know, there are a couple of questioning faces. Yeah, I don't know what she's thinking. Yeah. Yes, good. That's a good observation. I don't think that's come up before. Anybody else want to add anything? My own, just unmute and interrupt me, okay? Because I'm looking over here at the screen and you. Nice, looks nice. Probably, so for a while this was a fashion. I guess it still is, but that's just a little too much, I think. Shirt showing and a little bit untidy, maybe in appearance, and maybe she should trim her bangs. Beautiful right here, clean, neat, nice posture, great pose. We said this young lady looks confident. I agree. This young lady looks wonderful. A little bit of a slouch there. Sometimes that's our natural, but that's why through all of it, you have to pay attention to what you're doing, so you can correct things and just make yourself the best possible person you can. So she missed the cue, the cheese cue. Nice smile, nice appearance, and this young man needs a haircut. So those are my observations in that. So lots of things about nonverbal, right? So always be aware before you step into that room, before you walk, you get on the sidewalk to go to interview day, make sure you're all put together and you put on this professional self of yours. And now let's watch, talk about some verbal messages. Are you speaking clearly? Are you articulate? Are you articulate, meaning are you getting that message across in an articulate way? Are you organized in the way you tell your story or a story? Do you talk nonstop? Are you a long talker, a short talker, you know, whatever those are? Is it hard to pull things out of you? Are you answering the question? That's a good one. So sometimes I suffer from this. I'm going to call it tangentiality. And somebody will ask something or there's a topic and I'm talking about it and I'm going off on a tangent. And like sometimes it's hard for me to even reel myself back in. Try to be very direct and then go off on your tangents. Okay, if you suffer from the same problem. If you know, the way to do this, all of this is to practice and practice with your friends. And I told y'all at Club Pre-Med, if you wanted to set up something where we set up rooms and y'all sort of interview each other and practice with real people, we can pull that together for you. Practice, 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 practice. I'm going to I'm going to give you something somehow in a second, but you put your hands on any interview question, all the questions you can get your hands on, you practice. But the way you practice is not read the question and think of the answer in your head, because you're not articulating it then. And it sounds perfect and beautiful in your head, but it has to come out of your mouth. And there's a lot that happens before it comes out of your mouth. So what you have to do is get on your Zoom camera, read a question, and then answer yourself in the mirror. I mean, in a video, tape yourself. You could share that way and see how you're doing. In case you're not good at self-analysis, but I think like we're probably pretty good at that. It's one way to start, and it's one way to start getting better at analyzing ourselves. So practice, practice, practice in the mirror, on Zoom, on your camera, video sometimes. Find examples, know your answer the question. All right, practice, practice. When you're in that setting, be careful of interrupting. That's easier to do than this. I'm looking at you all now and all of your tiles. When it is a small group and we unmute, you just can't help but compete with each other now and then, every once in a while. I invited you to unmute yourselves, right? If you have something to say. So if more than one person takes me up on that invitation, we're gonna stumble over each other a little bit. In the virtual setting, I think people are gonna be very forgiving of that, okay? When it's one-on-one, I think it still happens. Just try to be attentive to that. I don't think that that's a big, in a virtual setting, I don't think it's as important a breach as it might be in person. Anyway, be a good listener, have a calm speed, learn to think on your feet the way you do. I'm not very good at this at all. I told you in the web chat, I'm not very good at this at all. I love time to ruminate about the answer I want to give to a question. But the way you do that, the way you get better at that is to practice, 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 practice. Organize your thoughts, work on your vocabulary. And I'm doing a lot of fillers. I realized after this web chat, when I posted on the channel, I look at a little bit of it and realized I'm doing these things I'm telling you not to do. So I'm trying to work on that and not use as many ums. But like, cool, and other slang words, you should really try to professionalize your language. You're going to need to do that when you take care of people. And as you're learning to take care of patients, you're going to have to speak in a professional way. Warm and casual can also be professional, so I don't mean stiff. I don't mean professional, be stiff and formal. I don't mean that. I don't think that helps the doctor-patient relationship. Certainly no expletives. Why would I put that in there? I want to see your faces. Why would I put that in there? I put these things, I give you these things, I build these PowerPoints because of experience. And there actually have been people, not with any attending faculty physicians that I know of, but when we have senior medical students interview. So it's meant, and our whole interview process is meant to put people at ease, but you can't get so comfortable that you throw around expletive words. If those are a natural part of your vocabulary, then you have to keep them at home in your private life, right? You got it? Let's see. You run into difficult questions or people, don't panic. It's perfectly okay to give yourself a moment to think about things, okay? Ethical situations, sometimes people get uncomfortable about a question, what if you don't match this year? And it's not meant to be predictive of your, or an assessment of the interview. It just means, what are your long-term plans? It's kind of a question sometimes people ask to see how committed you are. I don't particularly care for the question, and I don't care for the one that says, why do you want to come to our school? I sort of think that's an unfair question. Anyway, some questions or people might be making you nervous. Just be prepared. Know that that's a possibility. Be ready for any kind of interviewer. You might think they're a little too formal, even mean. Are they going to be friendly? Are they just sitting there bland? You know, in the MMI situation, we're going to talk about that later. There are some MMI interviewers who are instructed not to have any feedback, verbal or nonverbal. So you have to get ready for that. You know, maybe they're looking at their notes the whole time, distracted with their phone, or they seem to you to be unprepared. So you have to be ready for all that. Do not. This comes up a lot in Q&As. Practice, but don't sound trite. You're not gonna sound trite if you really believe it. Now, after you have said these beautiful words that you've organized in your practice session, and you've got it all in your head, and you're practicing telling your story, and you're interviewing, God bless you, at the 11th school, you still have to muster that enthusiasm, you know, because saying you've got it all right, it sounds beautiful, but you have to pull up your enthusiasm for that. And you also need to generate some enthusiasm and energy if your interviewer is a potato. You know, if it's somebody who just is not responding much, don't let, we react to faces. This is why I love to watch your faces. You know, we react to that, and we give each other good energy to proceed with the story and the interview. So be yourself with positive energy, and you can help that. So interview day etiquette includes map it out, go early. This is, of course, an in-person interview. Find out about the school's mission and things about them. I do think a fair question might be something like, what do you like about our school, or what do you think you like? Or you've been in the info session this morning, what things stand out to you that you like? You may take notes. You just like taking patient notes. We have a problem with that with the EMR. So when in the olden days, up until pretty recently, we were interviewing a patient and taking notes, and always taught and teach our medical students, don't let that note-taking interrupt the doctor-patient flow, the relationship that's happening there. Don't let it distract from that. So I would say the same thing. You don't want it to distract from the good energy of the interview. Now what happens, it's terrible. So now what happens is you're, where are you? There you are. Your patient is right here, and we should be talking like this, but the computer is over here. And so we're sometimes like asking questions of the patient who's behind us, and you have to watch that. When I see medical students and residents do that, I like give them an elbow and like make sure they turn around to say hello to their patients, and talk directly with their patient, eye contact, right? So more etiquette is all eyes are on you from the moment you walk in there. Be nice, polite. I told an example in the web chat that it impresses us when somebody, you know, a lot of times it's a big group and lots of people are coming to the check-in table at once. So it's always very impressive when people stop and make eye contact and don't just pick up their water bottle and their goodie bag and go sit down. I mean, we're people, we're standing there, we're greeting people. And so that makes an impression. So whoever greets you that day, make sure you stop, and you're looking for your name badge or whatever, but say hello to the people there. They're there to greet you. Lunch on interview day is not a time, as I say, to pack it away for the winter. Besides the fact that it might make you sluggish, you know, watch your table manners, and make your mother or father or primary caregiver proud, because manners do matter. It also impresses us, you know, again, I put these things, these are all bullets because we run into good and bad examples of this over the years. Make new friends. I'm always impressed. I'll see people talking and I'll walk up and say hello, and you all must know each other. And sometimes people say, no, we just made new friends. So that's nice too, to see interaction. So one important thing for interview day etiquette is you do not ever ask the interviewer, how did I do? That's awkward. It's not, you can do that now. When it's a mock and a practice setting, you certainly can, but you don't want to do that in the real interview. On your evaluations of the day, this is another chance to display your professionalism, even though probably 95% of people, we don't ask for names, but sometimes people write their name, and I'm always, I like that. Make sure it's whatever you're talking about is professionally stated, no complaining, you know what I mean? And if there is something that really should be fixed, you should be specific about it, and maybe even talk to the dean or the director who's there in charge of the interview day, so that they could fix something before you go home. And thank you notes are always nice. Is something you have to do? No, not necessarily. And they can either be paper, the good old-fashioned way, or email. Either one is nice. So let's shift a little bit to some newer assessment methods. Situational judgment tests include things like the MMI, the multiple mini interview, and the CASPer. The interview questions fall under 3 types: general, which would be what's your favorite book, what do you like about our school. Behavioral are questions like tell me about a time when you did this or that, or in this kind of a situation. And situational is a hypothetical situation. You're assigned a role and then asked to say what you would do in that situation. Those are some examples. Tell me about a time you had to collaborate with someone who was difficult to work with. What would you do if you disagreed with your supervisor on how to handle a problem? What are you are working on an important project that you can't complete because you're waiting on work from a team member or colleague. That's common. You've worked in teams, right, to complete things, and we're responsible to each other. And what is a high level response to that? You know, think about this one. You're on night shift as an intern, and the patient has palpitations, chest pain. The EKG does not look right. You know it's abnormal, but you're not really sure what to do. You're trying to reach your intern who just says, send me the photo of the EKG, take a film of it and send it to me. You've been trained not to do that. It probably breaches the security in that institution. What are you going to do? So we don't have to talk about the answers. Some hard questions, right? Right? I mean, I would have to give it some thought, all of those. So here's the CASPer. The CASPer is specifically set up to test these 10 personal attributes. It is, let me see if I can remember what it is. It's computer-based assessment sampling of personal characteristics. That's what CASPer stands for. Collaboration, communication, empathy, equity, ethics, motivation, problem solving, professionalism, resilience, and self-awareness. Really covers anything that we can think of in our committee. They don't give you a section on empathy and measure empathy and then you get a 9 out of 10 on empathy. It is a 12. Do you want to know this? How's my time? I think I only have a little bit longer to go. Are you all okay? And we're taping it in case you do have to leave. I just read the chat and that gets me offline. I'm sorry, but let me answer Brittany. And then Brittany says, is it better to say out loud, I'm thinking about this, or stay silent? I would say, let me think about this. And then the interviewer knows that you're not bewildered completely, that, you know, it's perfectly fine to take a moment to think about it. Perfectly fine. But as you practice, you're going to get good at this. So it's a 12, let me see if I can get all my details straight. It's got 12 sections. It's, you've got 5 minutes plus a break. So it takes about an hour, a little over an hour if you take the break. and it puts you in, I think it's 8 video scenarios and 4 written and scenarios, and they'll show you a scene. Did I put examples in here? I did not. But you can go, the CASPer website, okay, is a great resource, and they will give you some examples there. Very good examples. So, and for a long time, for several years, people have been saying, you can't prepare, you can't prepare. It's like a test. It's like taking your, let's test your blood sugar at this particular moment. And so I don't think it's like that. I do think you can prepare. And so you want to go to the CASPer website, use their resource. Read about ethical dilemmas. Read about group dynamics. How do you don't have to get a book, but get, just Google research. What are great group dynamics? How do high functioning teams function? What happens in that team? So you learn about these things, okay? Learn about professional ways to manage issues or problems. Learn about cultural competence. Learn about other people. Develop an aware. This is just beautiful for all of us to know and learn more and more. We're not ever finished learning it. It's constant learning about different perspectives, people's different beliefs and backgrounds, and the more we learn, the more we can be respectful of everybody's different perspective. List and review. They're going to ask you behavioral questions. List and review your own challenges. Think of specific examples for those behavioral questions, like, what was a great challenge? What's challenged you the most? How did you overcome it? That kind of thing. And think about the personal attributes that we just went over. How would you, I think I'm going to repeat myself in a minute, but that's okay. How would you display empathy in this situation? How would you display resilience in the answer while you're answering this particular question on the CASPer or in an MMI setting? How would you display maybe you've got them, but you need to think, how is teamwork and collaboration portrayed here? And use that in how you answer. So all of this, am I going to say it now? Yeah. All of that, all of the preparation that you do, and I've got some more hints, is not cheating. It's not gaming the test. It is helping you learn ways to be better, right? If you are thinking about group dynamics and how do teams work, well, the next time you might be right now learning that to prepare for the CASPer or MMI interviews. But what does that do for you? It arms you with more information. You've learned then, if you read a book or a monograph or an article about great functioning teams, it arms you so the next time you are in a team where there are difficult situations, you can employ those things that you learned, right? So it's not gaming the test. It is, it's learning. So I think it's great. And I want to put a plug in for the personal growth plan. Do you know what MEA is? If you've heard me talk, you'll know that those are the components of a holistic review. Every medical school everywhere will tell you they want well-rounded people. Their holistic review includes metrics, experiences, and attributes. You work on your grades, right? You work hard to make great grades. You work hard preparing for the MCAT. You work hard getting your shadowing and filling your time with these great things that you want to do to help and to learn about people. But what are you doing about your personal attributes? If you're painfully shy, are you working on that? If you're an aggressive sort of personality, are you working on that? Are you overconfident in some settings? Are you working on that? So that's if you tune in, not next week, but 2 weeks later, that web chat is going to be about, we'll just talk about personal growth plan stuff. So I think we can all learn how to do these, be in a tricky situation and learn how to handle it better. So it's not just taking the test. You are growing and learning things that might indeed help you on the test. Anyway, prior, you're gonna have to type fast. So if you don't have proficiency on the keyboard, you need that. You can, apparently, I have learned on YouTube, other great resources there that you should look into. You can put Grammarly on your computer, and apparently it can be used in the CASPer test. Your words matter again, so they're watching for that. So watch slang. Grammar really doesn't, they don't grade off of grammar. During the test, you want to take a few moments to understand each scenario. Focus on what's, gosh, so many things may be running through your head, but focus on the most important thing. Look at all the questions first. You want to demonstrate an understanding of the issue at hand. Present both sides or all sides. They will be judging people on originality of answers, but if you do your research and are learning about business principles and ethical principles and things like that, you're going to be prepared to be have some original answers. And there are no right or wrong answers. You want to understand all the roles in the scenario. Focus on your role. When the camera in CASPer, the camera comes to you and says, what should we do? Focus on your role. Try to come up with the most effective outcome or an outcome with the least negative effect, right? Positive and professional. Think about conveying personal attributes. So again, you realize that teamwork is a big component of this question. How are you going to demonstrate that, right? So think about those key personal attributes and how you're going to convey them during the test. There is another question. When answering CASPer questions about personal resilience or sacrifice, do we write? So the CASPer is going to tell, I'm not exactly sure what a resilience scenario looks like. Those might be a question on the CASPer about resilience or challenge or sacrifice might be one of those behavioral ones where it asks you, what is your experience? What challenges have you had? So it might not be a scenario. I think you absolutely, so it depends on the scenario. If they're saying, here's the deal, what should these people do? Then that's a hypothetical situation you're putting yourself in. Otherwise, you can certainly use your own stories. Okay, they'll probably guide you, Natalie. Okay, so let's talk about newer ways to do things. All medical schools in Texas, unfortunately, are having to go. I guess there are some good and bad things about it. Are going virtual this year. We're really, so many of us are really sorry that you cannot visit our campuses, but we're going to find ways for you to do it as soon as things do open up. Maybe instead of second look, maybe we just have open it up as soon as our cities open up and invite people to come. Anyway, beforehand, you practice the technology, record yourself, like I said, test your camera, your mic. There are some, I'm going to post another link on the channel to another resource that we found. You need to make sure you're fully charged and plugged in during that. Dependable Wi-Fi, check your speed with speedtest.net. Find a suitable environment. If you do not have a suitable environment, spotty Wi-Fi or whatever, dogs or kids in the background, check out your campus, a nearby campus. We're all asking our institutions if there are ways for people to be in a room on our campus if they can't be in a place that's dependable. So make your bed, or better yet, have a neutral background, something not distracting. I wouldn't use those video, the ones that the waves are going, and the palm trees are swaying. I would use something that's static. Find out what they're going to use. Zoom, WebEx, Teams, find out the venue and get familiar with it. Know what those windows, how to manipulate your windows. Video on, of course, this is the real thing, right? So in a real setting, on real interview day, when there's a big group of people there, you will not put your tile on. You'll show your beautiful face to the camera. You'll put your whole face. If you need to adjust your camera, put your laptop on a stack of books. You don't. The best view of us is not. We all know this from selfies, right? The best view is from above. So try to situate things properly. Good lighting. I think one of our next big ask me about it. Email me. Maybe we can send you one. Our next big promo item is a light that goes on your device, so it illuminates your face in these new video interviews that you're going to be doing. Isn't that cool? Eye contact is so important. When I'm looking at you, I'm telling you I'm looking at you because right now that's where you are in the gallery. But when I'm through with the presentation, I will situate everything back here at the camera. You want to make sure in that one-on-one interview that the object of your attention, your interviewer, is situated in close proximity to the camera, closely approximating eye contact. Mute yourself unless invited to do otherwise. Put your real name on the screen. Get rid of the dog. Put the kids somewhere. Emphasize your attentiveness. Use the chat function. Use the emoji function. I think that shows great engagement. I tell you, I look at the gallery all the time, and in big events, even where we have 300 people came to our virtual welcome weekend, and I was scrolling through all the time because that's how I connect with you, is finding you there and watching your engagement gives me energy to do a better job of delivering my message to you. So engage in emoji and chat functions if you're invited to do so. You need to dress for the occasion. No pajama bottoms on, or sweatpants. Comport yourself like a professional. So it's interview day. You need to act like you're at the table sitting right in front of the dean who's talking to you. Remind yourself to sit up straight every now and then, which I have to do too. Virtual water. So I think it's better. I just think you should have a cup or a glass, and then you're not like, we don't see you like, your Adam's apple bobbing up and down. And again, I say interruptions really can't be avoided. So just apologize once. Sometimes I've been on a few meetings and calls where I say I'm sorry, and then that person says I'm sorry, and then we're like competing with each other to say we're sorry. So just like little signal, short, sorry about that, and then wait until you're invited to talk again, things like that. So it just can't be avoided in the interview setting, especially if the Wi-Fi, if there's a mini second delay. Let me see, is that my, yeah, let me, synchronous. So a lot of you, thank you for doing that. I hope it was fun. A lot of you took advantage of the SOV, standardized one-way video interview. So a couple of schools across the country use this. We're using it this year. We piloted it with LMSA in the fall and again today, and our committee loved it, and it gives you a chance to present yourself in a very professional way. On our SOV that you will tape on our website like you might have done today, you'll record, you can go in and first see the questions, look at them, take notes, listen to all the instructions or the intro videos that we do, and then go away and think about it, make notes, bring notes. We don't mind if you do that. We want you to be prepared. There is no skill that we need from you right now that is instant thinking, of a great answer. So we don't need that. It's anyway, our committee reviewed those from last fall and just loved it. So I think it's really going to act in a person's favor. So here's who are we going to pay attention to here? Like who's giving us, if you have to give a presentation and you're talking to all these people, well lit, can't see many people, hear people in tiles. I'm not going to focus. You can see my mouse, right? I'm not looking at this person because they're not like engaged really. It's going to like distract me and make me think I'm not doing a very good job. Look at this one. Look at this one. Smile, 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 smile. This was my high school graduation was last Saturday. I mean, the high school where I went. My high school graduation was like a million years ago. But everybody was on the field 6 feet apart in their beautiful white robes, and they still had all of their teachers together in a Zoom, I presume Zoom, looks like Zoom to me, meeting, they said our little pledge together. I only caught a second of it, but I took this screenshot because look at it. It's beautiful. 99% of people are bright. You can see their whole face on the screen. Everybody's smiling and engaged. So that's who you want to be, are some of those smiling people. So there's a plug. If you need to know how to join Club Pre-Med, you go to our admissions page and let's see, and go to the pre-med section and you'll see how to do that. Okay, you can unmute yourself if you have a question for the students or me about anything, application or interviewing or anything else really. And we'll stay for a little bit longer. Let's see. Mershad says, should there be a balance between looking at the screen and the camera? Well, right. So that's what I mean. If your screen is, so if you mean in the presentation portion of an interview day, you still want to look like you have eye contact. So sometimes if you, what's it called? If you minimize, not maximize, not minimize, what's the other one? You open it up, not full screen. So that's why you play with things ahead of time, because you can say, okay, I'm gonna put the speaker and my PowerPoint right here. That's what I did when the students were talking, so that I was looking at the screen and who's talking, and it's close to my eye contact, which is really my camera. Does that answer your question, Mershad? And definitely with an interviewer, you want to try to, I mean, a balance is okay, especially if you say, if you're on a, like I can move my camera, if you're limited by the size of your screen or other things, especially if you say to your interviewer, I'm trying to look at you, but it's down here and I can't move you. You can just call it out. That's fine. You know, that lets them know you're aware of engagement and eye contact. Let's see, should there be a balance? Are there going to be any more resources to get the feel of a school since interview? Yeah, so we are all, this is Brittany's question. Thank you for asking all of these questions. We're all trying to come up with ways. So we don't have our interview day outlined yet. It's going to, has to involve our medical students, which our medical students are present all throughout the day in a normal interview day. And so we need to find ways to engage people in Q&A sessions and in a quiet group. You know, people might not be chatting or unmuting. So we're all learning ways to engage people, icebreakers and that kind of thing, so that they can really get some good information that they want from our students or the faculty. We are going to have even a virtual lunch. I think the students want to, we met with them maybe a week or two ago. Oh, that's something else you shouldn't do. So don't do what I do. Like, don't play with your hair, okay? Or your bangs and stuff that you see me do. We are going to have we have like the best lunch on the Texas Interview Trail. I think it's probably the best lunch across the nation or at the top. And we have students, we have applicants at the table with student hosts and faculty hosts, and it's just a great experience. And so the students really want to continue that. So maybe we'll say, have your brown bag ready, and we still get to meet around a table and talk to you. Okay, great. Any recommendation for a good, not too expensive webcam? So, yeah, and I suppose you could have a device and a separate one. I plugged this one. It's on the web chat that we did a couple of weeks ago. Logitech. It's a Logitech HD 1080p, and I think it's $50 or $60, which I know, you know, it's another expense to add to your interview budget. But I kind of like it, and it has some features where you can like do a soft focus. Like, y'all aren't really seeing all my wrinkles because I have the camera settings just right. you can see some, but anyway, I like it. And I think that you can hear me well, right? It's not echoey or anything. When I listen back to recordings, it sounds okay. The deadline, what's the deadline to be considered early? And taking into consideration the COVID semester. So I think we have done a disservice to some people by saying early, get your application in early. So some people even rush to get the CASPer done before they're quite ready. Now, you can prepare for that. Some people rush their MCAT prep. Well, that's a whole nother discussion, since they're canceled and rescheduled and everything. So I know all of the schools in Texas, we are great team players. We're a great team. And we talk about things and try to make things as easy as possible for you. And when we can have one voice, we do that, and give you one voice. And we have all gotten together. And that's why all of the time, all the points on the timeline have moved forward a month. So we are all going to have, and we really do this anyway, most of us, we don't fill our interview spots in with early applications in May or June, although the statistics do show that people who submit early they comprise most of the interview pool. We all have pledged that we're going to have spots all through the interview portion of the cycle. The interview portion for a lot of schools this year is going to go from September, maybe late August, maybe mid-August, we'll just have to see, into January and even February. Before, we were really finishing, several of the schools, Long School of Medicine included, we were finishing our interviews in December. So now we all go through that. See, I'm not answering the question, am I? Kind of. So let me see. I have to scroll up now. Deadline. Yeah, a deadline for being early. I wouldn't hit the deadline of November 1. I would try to get things done, maybe into September. We're a month delayed, so maybe at the beginning of October, which was very late for the past several years, might not be quite so late. You have to be ready. And if it's approaching October and November and you're not ready, then maybe it's not your year. That's another tip or principle I have on the tip sheet somewhere is, apply when it's your best possible application. Okay, you're welcome. And Davyani says for the meaningful activities section, yeah, so Davyani, you can go look for a longer explanation, but there's good, better, best. So if they're asking you, do you have health care? A good answer is to say, I shadowed in pediatrics and followed Dr. So-and-so. Better is to say, I was also involved in putting patients in the room. I did some triage. I learned to do, I did vital signs, what you did specifically. Best is to say what you did, what you learned, what did you learn, or what is most meaningful in that activity. Now, you might not be able to do it for everyone, every single one, but I remember an application, and I'll tell you the person's name. I could tell you the person's name who did it for every single activity. Here's what I learned. And it was always something different. And I believe it not just to be a mechanism that he was trying to do, but to really, it makes you reflect on, why am I doing these things? What was valuable about that thing? So I think it's all good. Oh, meaningful activities. So I meant that good, better, best is for any little activity that you're going to report on. Should we try to fit a story involving our activity there, or just, so I think it's going to be one of the things that you mentioned already, because they're asking for a meaningful activity. If it was meaningful, don't save it for that section. So just expand on it a little more. And you could even say, please see below. This was one of my most meaningful experiences, see below, and then use 50 use 50 because you've got 500 later. I hope that helped. If we have, sometimes I skim, and so I don't get the whole question. Answer the question. Don't do what I do, right? If we have a specialty of interest and it ties to our story, is it off-putting to mention it? I don't think so. I'm open to different areas, which I mentioned, but this is a passion of mine. I would hate not to mention. Absolutely. If you're passionate about it, do it. It does seem a little, we take it as a sign of like, being a little naive or even inexperienced. If I see them just a few times every year, a personal statement is all about pediatrics, all about pediatrics. They love children. They're going to be a pediatrician, et cetera, on and on, the whole thing. Passionate, the passion is there, but then you go to the activities section and what's in there? Not much, So if you have experiences and you're passionate about it, go for it. And you just state, I'm open to all kinds of things, but here's my passion and here's why, could you elaborate on a paper thank you letter? So that's certainly done. I don't give any thank you more or less value, really. I love, I'm old fashioned in some ways. Some, not all, and love paper and love to open an envelope and see what is in that card, and I save them all. My gosh, I'm not dying for a long time, but my family's going to have a hard time like going through boxes, and because there's all this meaningful stuff in there that I, like on a bad day, I pull them out and read them. But I save emails too, things that are really nice and heartfelt. So either way is good. And I do have people who hand them to me, like not right there at the, and you won't have to worry about handing it this cycle if this is your cycle, because you won't be able to hand something in. But at the end of the day, we get them, and that's wonderful too. Oh, you're very welcome, Tanvir. Nice to see you there again. May have missed this, but as a follow-up, transcripts are being requested later. When would interviews be starting to be held? So we certainly look at any transcripts that you've got to send in, but for the close, and whenever you close out a semester, you need to send them to TMDSAS and the school. You would get those instructions later in the cycle, way after interview, into the winter semester. So don't worry too much. Get all the transcripts that you have, get them in. But that's not going to be a deal breaker. Most schools, I can't speak for all schools, but I know a lot about all the schools. Most schools will interview a person with the GPA that is handy there, and without a letter of recommendation. There are some schools who wait for a letter of rec. We have most of them by the time we invite for interview, but it's not critical. We have to have it by the time that person is evaluated in committee. So grades, MCATs, and we are waiting for MCATs to invite people for interviews. So I hope that answers your questions. Anything else? Anybody want to unmute and ask anything? Students, do you all have anything to add? I think I do remember one thing I was going to add. Oh, yes, I remember something. And I'm happy, I'm happy to share resources. I've got a million pieces of advice and pieces of paper and virtual paper to share with you with all kinds of stuff on there. And so one thing I do give to people, I put it in their packet at Second Look, is a matrix that a medical student gave to me. And I was, I can see his face, Chad, wouldn't mind me telling you his name. Chad had interviewed at many places, and he made a matrix. So a little bit farther down the road, you've got your Excel now, but I said, okay, can I share this? And he said, sure. And I give people a matrix, and you can make your own digital version. And it says pre-clinical curriculum, clinical sites and clinical curriculum, the feel of the campus and why, the students that I interacted with, and you fill in for any school you make a column for every school where you're investigating, and then you might need another column there once you hit the interview there in person. You know, everybody needs to find out as much as possible. I started to talk about the what additional information we're giving you, but actually that skeleton document has a lot of details on there for comparison. You want to do a comparison. That's the other thing I want to say. You know, find criteria that are, I'll share the matrix with you anytime. Maybe I'll post it somewhere along the way. Find things that are important to you about a school. You know, I say this periodically. We may enjoy a terrific reputation, but what's in that reputation? How do you do on your match? What is your curriculum really like? There are a lot of similarities across the nation about curriculum, but find out some things that are important to you. Where can I go from here? What kind of things do your students end up doing? And that gives you a lot of good information. And honestly, a lot of schools have a lot of stuff, so you'll need to take copious notes. The next Zoom meeting, Edna, if you will, like, how do I tell you to do this? So I should have had some links prepared, but if you'll go to Google or whatever browser you want to use, go to Google, type in Long School of Medicine. You'll get to the UT Health Science Center. We're 5 schools. So you'll get to the institution level thing probably first. Look for education. That's going to be or find the medical school. Click on that. Then on the left, on the green bar, you'll see admissions. And we have a pre-med section. And it'll say how to join Club Pre-Med. And I think you might see, and that's a Survey Monkey. And then your email gets on the list. Okay. So, and then we send you a registration link and send you out the next thing. So next Tuesday is a just fun, easy, light, but I love it because it's superpowers. So that's next Tuesday. So we'll talk about superpowers. They're going to help you in medical school, but they're going to help you for life too, I think. Oh, who did that? Sydney B. Thank you for doing that. Appreciate it. I can't, I get too distracted if I'm multitasking too much. So next Tuesday is superpowers, and 2 Tuesdays after that is going to be a personal growth plan. How you make it, why should you make it, what does it mean, what are you talking about? It really is very pertinent to your application. So, you know, I could hang out here with y'all for a long time. Will an email be sent out? So tell me what you mean. And then I'm going to tell me what you mean, and then we're going to, the Zoom link for Club so Long School of Medicine Club Pre-Med web chats happen on Tuesday, the 2nd and the 4th, the 2nd and 4th Tuesday of every month. And then if you sign up to join the club, we will send you the Zoom registration, which automatically gives you the email to the Zoom link, okay? So Natalie, make a group me. That would be great. So I think we're going to close out. Where are my students? Did you have to go? Oh, I see Natalia. There's Cassie. Do you all want to say bye? I'm going to say bye. It was wonderful to see you all again, and to meet some new people. So thank you so much for being here. I enjoyed it. I mute myself now. And here is Natalia and Cassie.
Thank you, Dr. Kellaway. That was so great, and I know the students really appreciate it. I hope you guys really enjoyed today. Most people are open to most of your pre-med students that evaluated, your medical students that evaluated your personal statements are open to keep looking at it and things like that. Just make sure that you keep in mind of their time. We're off for the summer until, I don't know, the last week of June, around there. But like I said, I told Nancy, I think she's in here, that I'd be willing to look over it, and so I'm sure other students will be too. So I'm glad y'all came, and I hope y'all enjoyed it, learned something new, or refreshed, or it was just beneficial. But thank y'all. And remember to do your post survey. That's very important. Wait, don't leave.
Yes, do your survey and we'll post this. I don't know if the chat comes up. I think, do I have to post that separately? If y'all wanted to make a group me, I'm not sure how to tell you to find each other. Maybe somebody knows this, but we'll post this video on the YouTube channel. So again, if you go to YouTube and look up Long School of Medicine Club Pre-Med, we have five videos posted. So just the most recent ones, but it's a start. And anyway, that's it. Y'all take care.
Yeah, thank you so much. Like Natalia said, we will be sending a post survey after this with the recording of this workshop. And if you have any questions, yeah, you should definitely try to, if your medical student said that they're okay with you reaching out to them, definitely feel free to reach out and ask any questions throughout this application cycle. But yeah, I hope it was helpful and thank you so much.
Good luck if you're applying this cycle.
Yes.
Bye, students. Y'all did a great job.
Thank you, Dr. Kellaway.
Yeah, thank you. It was wonderful.
Great. Thank you for your help.
You're very welcome. Y'all stay well. I'll talk to you soon. Okay.
Thank you. Have a good
Bye.
weekend.
Thanks. You too. I'm closing the meeting now. Bye, y'all.